Thanks, Carrie. Plastic surgery presents a world of options for changing the appearance and body. Today we kickstart a four-part series exploring the facts around 4 of the most common plastic surgeries. Local Dr. Darren Hubert joins us with a look at liposuction. Good morning, doctor. How are you?
Good morning. Fine, thanks.
Great. Many of us have heard of liposuction, but let's go through what this actually is.
Sure. Well, liposuction is at the heart of it is a shaping kind of procedure. It's not a substitute for weight loss, but it really aims to treat those stubborn areas of fatty deposits that just don't seem to respond to a good diet and exercise regimen.
What makes a person a good candidate for liposuction?
Well, they should have a relatively stable weight. So if your weight is fluctuating quite a bit, you should wait until you've lost the weight that you're aiming for, and you're at a good stable place. The other thing is good skin tone is very beneficial. Liposuction does not get rid of extra skin. So if extra skin is part of your problem as well, having good skin tone can definitely help with that. Would
that end up becoming almost a supplement to a liposuction surgery if you did have excess skin?
It depends how much extra skin you have. If you have a significant amount of extra skin, oftentimes liposuction may be combined with another procedure that helps to get rid of the extra skin as well.
Does liposuction happen all at once, or is this a multi-stage process?
It's usually one time. The targeted areas are treated, and then you go through the recovery period. And unless if you put on more weight, you could redevelop those areas, but it's usually a one-time procedure.
Let's talk about that recovery period, because it's not necessarily a walk in the park having liposuction. So what does the recovery period look like for folks?
Well, usually at about 1 week, most people could be back to work if you don't do a real strenuous kind of job. By 2 weeks, you can be increasing your activity and starting to get back to normal things. The biggest thing is during the recovery period you wear a compression garment. So that's a real tight sort of undergarment device which helps to keep down the swelling and really sort of holds things in as they improve.
Yeah. I believe we have a couple pictures that we can look at, and this is probably a pretty common procedure for you. This was a young lady. Now, is that the before or after? That kind of looks like the after to me, but if that's the before...
That looks like the before to me.
What is she?
So she had liposuction in the belly and the thighs there, and despite being very fit, you can see how there's a little bit of a pooch on the lower abdomen and the thighs, and then afterwards she had very good skin tone and really had a great result.
Yeah. That I think I have that pooch beat actually, but but nonetheless, I can see the difference between how that is shaped. Now, the risk of gaining that weight back, is your area it's taken care of? You said you can gain it back.
Sure. So liposuction involves a couple small incisions, and essentially the fat cells are sucked out. You can now those cells aren't replenished. But if you were to gain a significant amount of weight, the cells that you still have could take up extra fatty tissue. So it's a good idea to maintain the good, healthy eating habits and exercise regimen.
Gotcha. So we've talked about who makes a good candidate and about how long it'll take to recover. Now, the pocketbook issue. What's the cost?
Sure. It's comparable to a lot of other procedures. In our practice, it usually starts around $3,900. Now that includes the surgeon's fee, the anesthesia fee, and the facility fee where it's done. That's an all-encompassing thing. Now, the more areas of the body that you're treating, of course, the cost can go up from there.
Absolutely. Now, do you see a most common area for you?
The tummy, the love handles, that's very popular. The inner and outer thighs also. In men who have some male breast tissue, liposuction is a very good option for many people. Sometimes the neck is another area.
Are there any areas that are necessarily not a good area to think you're going to go in and have liposuction done?
Well, you certainly, it wouldn't be done just by itself in areas of the face. For example, the lower part of the arms, the lower part of the legs, those can be very difficult and are less forgiving in terms of having a good result.
Well, thank you. You've demystified it for us. Lots of good information on liposuction. Appreciate you coming in.
My pleasure.
Dr. Darren Hubert. Well, we're going to send it right over to Cheryl.